My name is Feike Gerbrandy. I'm a Dutch eye doctor specialized in the laser treatment of vitreous floaters. And I made this presentation for the ESCRS 2017 winter meeting. And it's about a patient that was operated for cataract, but after the surgery, he was still complaining of the same blur that he had before. This was due to the fact that his blur was not caused by his cataract, but by a floater that he had. We look further into this type of floater in this presentation. Here we see a picture of an eye. If you look at picture 1, you see the red arrow. This is the light that enters the eye via the cornea and then crosses through the lens and the mid-vitreous and finally coming to the retina. And in picture 1, the patient looks straight and the floater is not visible. But when he looks down in picture 2, the floater will move up into the eye. And in picture 3 and 4 and 5, you see it falling down, crossing through the center. So here it's in the center. In 5, it's down below at the original position. And this will happen at every time he moves his eye in that certain way, which can be hundreds or thousands of times per day. Very annoying. This is a video that shows the floater in detail. We see here this little thing is the Wise ring. On the back you see the retina, and when the patient moves left and right, the other cloud will move around. You can see it slowly coming from left to right, and there we go, and it goes back around from right to left through the center. In very slow motion you see it now moving from right to left, now again from right to left, now in front of the macula. That's what he sees. And if you look, if the patient look down, you can see this little cloud behind the lens, which is not that little. If you look at it, it's quite big for the eye. So this Wise ring plus the other inferior anterior cloud is called a floater duet, which is a highly annoying floater and can be treated with laser, but it's difficult and needs a lot of experience. So now let's move back to our patient. In picture 1 we have the situation with his original lens and the floater, and in 2 we have him with an artificial lens but still the floater, and ideally we have situation 3 with no floater and the original lens. So how can we do this? 4A is the treatment option that's mostly done doing nothing, and 4B is a vitrectomy, which is a high-risk procedure, and 4C is a laser treatment. The little gray balls are gas bubbles that appear during the treatment. They will disappear after a few hours. If we move to picture 1A or 1, we see the laser treatment with the original crystalline lens in place. You have to be very careful for hitting the lens, and that's called traumatic cataract. In picture 2, we have the artificial lens, which is much stronger and more resistant for the laser. So you prefer to do it in a pseudophakic eye. And if you do a couple of treatments, you can make the floater smaller, and in the end situation it's not completely gone, but small enough that it won't disturb you. The advantage of laser over an operation, the PPV or vitrectomy, is that the laser is less invasive and has a lower risk and still has a pretty good success rate. However, there are some problems such as elevated eye pressure in a couple of 1 to 3%, and there's a chance of traumatic cataract, which is mostly the learning curve effect. And if we move to the vitrectomy, it's faster, it's a higher success rate, but it's considered a high-risk procedure. So recommendations for the cataract surgeon is first how to avoid missing this. Well, you have to do a dynamic fundoscopy, so have the patient move his eye back and forth while you're looking at the vitreous, and you will see the floaters flying around. And you also have to talk to the patient and ask him, do you see, is this blur constant, or is it only upon eye movements? If it's constant, it's more likely the cataract. If it's on eye movements, it's maybe the floater. And 3, if you have seen this floater before the surgery, tell the patient, because he will understand that after the surgery he will still have this blur and will not blame you as the doctor. 3, the timing of the removal. As we mentioned earlier, it's easiest done after surgery, cataract surgery, but then wait at least a few months to avoid risks and give the eye some time to recover from the surgery. The treatment options are 1, the refractomy, which is high success rate, but not the method of first choice for most patients because it's such a high risk procedure. And secondly, you can do laser, which is has a lower success rate, but it's much less invasive and is a low risk procedure, even though several treatments can be needed. Well, thank you for your attention. If you have any questions, you can contact me at my site, floaterlaser.nl, or at info@floaterlaser.nl. Thank you.